Good morning, Mrs. Ndeli. My name is Sister Hozani. As you can remember me, I was there when you were delivering your baby. Can you remember me?
Yes, I remember, sister.
I am here today to check on the baby. Normally, every time a woman delivers, we check the baby before the woman is discharged, so that we are sure that everything is going well with the baby. But before checking this baby, I'll have to take temperature first. If the temperature is not normal, we won't continue. We'll have to refer the baby to be seen by the doctor. Let me confirm your name. Oh, this is your chart. You are Mrs. Ndeli. Let me also look at the baby name tag. Oh, this is also your baby. I will be checking the temperature. I'm checking the temperature. The temperature is normal. If the temperature was 35 and below, we were going to say the baby is hypothermic. And if the temperature is above 36.2, then we will be concerned that the baby is having a challenge. But your baby is fine. The temperature is normal. Let me take the baby from you for a little while. Don't worry. As much as he is crying, is he or she?
It's a she.
Okay. As he is crying, but don't worry. I'm not going to keep her long, and I am not going to expose the baby to feel cold. I'll make sure that every time I do whatever part that I'm examining, I will only expose the part that I'm going to examine. I will be examining the head first, so I will remove the blanket from the head. I will look at the hair. By generally looking at the hair, I can see that the hair is normal. There are no abnormalities. There are no bruises at the head. There may be bruises in the head because due to the process of delivery, sometimes the baby gets some bruises. I will also examine the fontanelle. I will start with the frontal fontanelle. I will also follow the sagittal suture to check whether there's some swelling or some abnormality. I will follow the sagittal suture to the occiput, where I will palpate the occipital fontanelle. I can feel that it is normal, it is not bulging. As I am palpating the posterior fontanelle, I will move the head of the baby slightly to the left. When I'm moving the baby's head slightly to the left, I am checking the tonic reflex. The baby will stretch the left arm as I am turning the head. I can see that the baby is stretching the arm. Then also when I'm touching this baby, as I was touching this baby, the baby was startled, and then it showed me the moral reflex, where the baby will stretch the arms, stretching the arms and pulling the legs up, showing that reflex is present with the baby. Let me get my tape measure. I want to measure the head circumference of the baby. As I'm measuring the head circumference, when you are measuring the head circumference, you must make sure that your tape measure is above the ears, and you are measuring the wider area, the wider part of the head. My head circumference is about 37 The head circumference shows that the baby shows the growth of the baby's brain, and also shows that the head is normal. There's no accumulation of water in the brain or in the scalp. I'm also measuring the height. I want to see the height of the baby. My height is about 47, which is a normal height. I'm continuing with my baby. As I said, I'm not going to expose the whole part of the baby. I will look at the neck, palpate the neck. I've already moved the neck, and I could see that there's nothing, there are no growths, there's no injury, and the head is moving. And the baby doesn't look like she feels pain when I'm looking at the head of the neck. I also look at the ears. There's no discharge. Look at the eyes. There are no hematomas. They are nice and white, and also the black. The nose also is fine. I will also look at the mouth. I will have to put my hand inside the mouth. For me to do that, I'll have to wear a glove. I'm putting on a glove so that I can palpate inside and feel whether the baby has got a cleft lip, cleft palate, and also you can also look here whether there are signs of a cleft lip. As I'm putting my hand, my finger inside the mouth, the baby is sucking my finger, which shows now the presence of the suckling reflex. As the baby is suckling my finger. So there's nothing in the mouth. There's no teeth, because some babies are born with some teeth. I'm continuing with examining my baby. I look at the shoulders. There's no dislocations in the shoulders. The arms are moving nicely. The baby doesn't have any injuries. As I am moving the baby's arms, I am also holding my baby like this, and the baby is grasping my fingers, which means that this baby has got the grasping reflex. It is showing me that it can grasp. Therefore, the grasping reflex is present. There's no abnormalities in the hands. I am moving forward, looking at the torso, the chest, and also the abdomen. There are no abnormalities. As I am now exposing the abdomen, I look at the umbilical cord. The umbilical cord is nice and pink, and there's no sign of infection. I'll also take this opportunity, Mama, to look at as you can see, the umbilical cord. You can see the umbilical cord. I want to show you how to clean it. You use the surgical spirit. You can get the surgical spirit from the chemist. You don't just buy any spirit. You look for a surgical spirit. Then you use your cotton wool or gauze when you are going to clean the umbilical cord. You will start at the outer area, and once, and you discard. Then you take another one. You clean now closer to the cord, and you lift. Make sure that the other part is lifted. and you clean nicely and you discard. You check whether there are any other part that needs to be cleaned. Then if there's another part that is not cleansed correctly, you can clean it again and then you discard. That is how you clean your umbilical cord, the baby umbilical cord. You don't put anything, you don't put baby powder, you don't put anything in the umbilical cord. Let me cover because I am done with this part and also discard my glove. I will turn the baby to the back. I'm checking the spine. As I'm looking at the spine, there are no irregularities. The baby it doesn't have any growths. There are no bruises or scratches. When I look at the buttocks, also the buttocks, there's nothing. Sometimes other babies you can see a navish if the baby is black, and if the baby is colored, you can see something like reddish. And especially if the baby was presenting with the buttocks, that means if the baby was a breech. My baby doesn't have any bruises. It's looking fine, and the anus looks clean and fine. Mama, did the baby pass any stool?
Yes, ma'am, she did pass the stool.
Okay. I can see there's nothing wrong with the baby as far as the anus and the buttocks are concerned. I will turn my baby nicely. I'll have to look at I'm looking at the genitals. As I'm looking at the genitals, I can see now this baby, the baby's sex. As you are looking at the genitals, you have to look at the baby's sex, whether the sex of the baby is clear. There's no other growth around. I can see that my baby is a male. There's nothing. And when I look, I'll palpate the scrotum. I can feel that I can feel the testes. You palpate the scrotum to check whether there are any signs of undescended testes. With my baby, both testes have descended. I check the legs. The legs, there are no bruises, no fractures. When I'm holding the baby, I'm touching the baby. The baby does not feel any pain. It doesn't look like she feels any pain. And I am also, when I'm stroking, I stroke the sole of the foot. The baby looks fine. Then I will check also the stepping reflex. When I'm checking the stepping reflex, I will hold my baby like this, as if the baby is standing. Then once I let the baby touch the surface, the baby will be like dancing or stepping up, like walking. So my baby has got the stepping reflex, because when I'm holding the baby, you can see that it's like dancing with the legs. Let me put my baby down. Mama, we don't see anything that is abnormal with the baby. As I'm covering now the baby, I will record all the things that I have done with the baby and record them in the chart, so that everybody, even if when you go to another doctor or to another hospital, when they check, they will know that this baby was done, the examination, and at birth, everything was normal. I am returning the baby to you. Thank you very much for letting me take care of the baby and hold your baby, I think you can breastfeed the baby. Are there any difficulties with you when you are breastfeeding the baby?
No, sister, there are no difficulties at all.
Is the milk coming out fine in your breast?
Yes, sister, although at the beginning it was a little bit difficult, but now it's okay.
It is usually difficult, especially with the first baby, but it will get better as time is going on. Let me record now all the things that I have done for this baby. Thank you very much.
Thank you, sister.